I never thought I'd be addicted to narcotics. I just wanted the pain to stop.
Not a day goes by that I don't think about the pain.
I told myself I can stop anytime I want to, but I can't.
It got to the point that if the doctor wouldn't prescribe it, I'd just go see another doctor.
I don't know how to stop.
Opioids can create more problems than they solve, and yet use continues to increase. National Council on Compensation Insurance. Narcotics account for 25% of workers' compensation prescription drug spend. How do we stop opioid misuse in workers' compensation? The solution involves all stakeholders: physicians, pharmacies, injured workers and their families. Pharmacy benefit management companies have the unique position to see behavior of all stakeholders throughout the duration of care. This bird's-eye view can help keep a watchful eye on physician dispensing and doctor and pharmacy shopping, and initiate proactive programs like predictive risk modeling, formulary controls, drug testing and monitoring, peer-to-peer intervention, nurse progress monitoring, and ongoing management. Working together, we can help injured workers manage pain without addiction. Americans consume 80% of the global supply of opioids, drugs once reserved only for the most severe cancer pain. Opioid sales in the U.S. have increased by 300% since 1999, and drug overdose deaths have more than tripled. The Centers for Disease Control reported that there were enough opioid prescriptions filled in the U.S. in 2011 to medicate every American adult around the clock for a month. Opioids and pain medication are expensive, addictive, and have a high street value, driving the temptation for fraud and abuse. What does this mean for the workers' compensation industry? To reduce instances of fraud, waste, and abuse in workers' compensation, payers should pay attention to the behavior of three communities: the injured worker, the prescribing physician, and the pharmacy, with a clinical as well as operational lens. PMSI's Fraud, Waste, and Abuse program uses our MedAssess risk intelligence system to identify and monitor high-risk injured workers, prescribers, and pharmacies, alert clients, and make recommendations for interventions.
Risk is a four-letter word that marks the potential for danger. Risk is something that every business must plan to avoid, or at least prepare for. Risk avoidance is what PMSI's Risk Intelligence System for Workers' Compensation achieves, identifying potential pharmacy issues that could undermine progression of care and result in higher spend due to unfavorable or poor health outcomes. PMSI has a tool that can help through the Risk Intelligence System. PMSI solution is the Media Assess Risk Intelligence System, RISC-IS. It's an innovative proprietary system that evaluates pharmacy data to determine areas of potential risk. RISC-IS is the answer that the workers' compensation industry has been waiting for: a business intelligence approach to data mining, analysis, and predictive modeling. The system monitors, identifies, tracks, and manages utilization at both a population and injured worker level to identify high-risk, high-cost claims, enabling clients to more effectively manage spend and validate that therapeutic regimens are safe, effective, and appropriate at all times during the claim lifecycle. PMSI's Risk Intelligence System is innovative and unique because it contains millions of historical transactions. It evaluates a client's pharmacy transactions against proprietary medication-related criteria and assigns a population risk score to the client's population and provides a comparable benchmark in order to develop a clear picture of the medication-related risk factors contained in the client's population. The assessed risk score and comparator benchmark are plotted on the population risk scorecard in one of the 9 categories, based on the proportion of low, moderate, or high medication cost, versus low, moderate, or high medication therapy risk. The scorecard screens against high-risk criteria and reports on the medication-related risk, highlighting the percent of the population that requires further intervention. The scorecard report provides recommendations to resolve concerns, allowing clients to focus on high-risk areas earlier in the claim lifecycle. The Population Risk Scorecard enables payers to identify and reduce both risk of poor health outcomes and costs associated with unnecessary medication therapy or potential fraud and abuse across the population. Now, managing risk is possible with PMSI's Risk-IS and the Population Risk Scorecard, managed by one of the industry's most experienced and largest providers of specialty products and services for the workers' compensation market.